So, good afternoon, everyone. My name is Dániel Szmola. We only have a few to go, so please hang in there. My research focuses on novel approaches in optimizing bone health, and my team and I are working to develop strategies to improve post-fracture care. I am a first-year PhD student and a fourth-year orthotrauma resident at Semmelweis University, Department of Traumatology. My supervisors, Peter and Zoltán, guide my research and clinical work. My methodology supervisors, Marie and Amir, help me greatly and ensure the rigor of our approach. My vision is an effective healthcare practice that helps maintain and perhaps improves optimal bone health. My mission is to find this most effective protocol to achieve this goal. We are currently focusing on three main projects, all interconnected. The first is investigating the safety and efficacy of physical training in post-fracture patients. The second aims to assess the impact of nutritional supplementation in post-fracture patients, so the same population. And the third aims to develop a clinical trial protocol that builds on the results and findings of the first two projects and will result in a comprehensive approach to improve survival and clinical outcomes in hip fracture patients. Our first project is titled Investigating the Safety and Efficacy of Physical Training in Post-Fracture Patients. This is a critical topic, not only because it affects a huge number of populations, but because we still have very negative effects of fractures, and only a few percentage return to pre-fracture care. Physical training has a vital role in addressing this challenge. It also has the potential to reduce both bone density and muscle strength loss, which is essential for recovery. Our clinical question is, does physical training cause change in clinical outcome markers in post-fracture patients? We hypothesize that structured training will indeed improve our outcomes and even reduce mortality. To address this issue, we developed this search key, which has 3 domains, and we pulled around 3,000 articles. We only included randomized controlled trials in this pool to ensure the highest standards of our study. After multiple selection phases, we arrived at around 195 articles. And worth to mention is during our selection phase, we increasingly realized that these various subgroups, we have many subgroups in this literature that have different physical training markers and different scores and many important outcomes. So this leads us to the immense task of the data extraction, which we are currently working on. And although it is a very hard work that we're doing now, it also has the promise to be the basis of many possible studies in the future. So, and we have an ambitious goal of finishing this data extraction at the end of March. My second study focuses on nutritional supplementation in post-fracture patients. It is increasingly common knowledge that there is a global pandemic of nutritional deficiency, even more prevalent in post-fracture patients, with protein, vitamin, and micronutrient deficits being common. Addressing this issue has the potential to improve clinical outcomes. Our clinical question, does nutritional supplementation cause change in bone-related markers and clinical outcomes in post-fracture patients? We hypothesize that targeted nutritional supplementation will improve our clinical outcomes, and we believe that it will also reduce mortality in the long run. So far we have 4,000 hits with this search key. also looking at these 3 major databases, and we will only include randomized controlled trials as in the first project. So according to our plan, we will soon finish the feasibility phase, and we plan to submit the Prospero at the end of March, realistically. And I would also like to mention my third project, a clinical trial protocol that builds on the first 2 projects. Currently, we are in the development phase, and we have 3 intervention arms. We would like to assess the combined impact of these 3 intervention arms on survival and other secondary outcomes in this hip fracture patient group. So to summarize, we are currently progressing in 3 interrelated projects, looking at physical training, nutritional supplementation, and developing a clinical trial protocol. We aim to submit the first 2 this year in fall, and we plan to submit the third in the next year around fall. And by integrating research and clinical insights, we want to make a lasting impact on treatment protocols for the better. And I would also like to conclude my presentation with this important reminder that the purpose of knowledge is action, not knowledge. Thank you for your attention.
Thank you for the presentation and the questions.
Thank you very much for the great presentation. I would like to ask, do you think that this improved protocol can be somehow implemented in the future?
Yes, I would really like to implement this as soon as possible, but realistically, we still need to finish the first 2 projects, and after that, we can have the development of this clinical trial protocol and then maybe a pilot. So realistically, I see it implemented maybe earliest in 3 to 5 years. So that would be my goal. Yeah.
Thank you.
Okay, 2 more questions over there. Okay, let's go.
Congratulations on your presentation. Since you have mentioned that you have multiple subgroups, are you planning to do a network method?
Yes, very good question, thank you. We are, how should I say, we have a great opportunity with this data extraction, so we have an immense data set, and I can also see that perhaps we will even have another project that will come between the first one and the second one out of this data extraction, yes.
Last row, left.
Thank you for your amazing presentation. And regarding to the first question, what do you think, how long should be your clinical trial?
Well, seeing the literature and also having some experience already in this field, I think we would need a couple of follow-ups that we see recurring, but at least I would say a year. That would be the best. For a year, we would need to follow these patients, yes.
Okay, thank you.
Yeah.
Still first row.
Thank you for the presentation. From what you've seen in the literature so far, which training protocol seems most promising for post-fracture patients?
Well, there are many, and for this phase, I would still wait because I still do not see the whole data extraction. But for example, resistance training seems promising, and also this high interval training, so high intensity interval training. I think these 2 will show us great results, but we have a lot, so we still need to look at it. Thank you for the question.
Okay.
I have one question regarding your second project. Will you differentiate between different etiologies of fractures?
Yes. Also, yeah. Well, we exclude pathological fractures, for example. So we're mainly like low trauma fractures. We include those, but we have also in the first extraction, we also have different type of fractures, different type of operations. So we have a lot of data, including this. So yes, definitely.